Hello Hello, good evening. I'm Justin Russell, a licensed insurance agent with Affordable Medicare Supplements, or AMS for short, an independent insurance agency where we help you learn Medicare so you can avoid mistakes, costly penalties, and help maximize your Medicare coverage with confidence. If you're new here, be sure to click the subscribe button, and all links to any publications or websites we mention in this video you can find linked in the description box below. So let's get started. All right, so we'll dive into our presentation here. This presentation is called Medicare for the Soon to Retire. So we're going to go through the 2020 Medicare and You booklet and the 2019 Choosing a Medigap Policy book, and these are both the official U.S. government guides. You can actually find these resources on our AMS website under the Helpful Resources tab here, and you can click on these and download them if you would like. All right. So there are 4 parts of Medicare. We have on the left-hand side here, Original Medicare, which is managed by CMS, and this is Part A, hospital insurance, and Part B, your medical insurance or doctors. Now we have this red dividing line here, and on this side we have Medicare Part C and Medicare Part D. Now this is Original Medicare, but these are offered by private insurance companies who are under contract to CMS. So what is your eligibility for Medicare Parts A and B? Well, you become eligible for Medicare one of 3 ways. The first day of the month that you turn 65, after receiving 24 months of Social Security disability benefits, regardless of your age, your Medicare would start the first day of the 25th month. And regardless of age, if you are diagnosed with Lou Gehrig's disease or end-stage renal disease. So you must have Parts A and B together to be considered fully insured under Original Medicare. And this here is just a sample of the new Medicare card. So we'll take a look at Part A. So Part A is your inpatient hospital coverage. And you can see here that we have a Part A deductible, and that is currently $1,408 per benefit period. We have hospital copays, and they are a $0 copay for days 61 through 90, $352 a day for days 61 through 90, and $704 a day for days 91 through 50. Skilled nursing care, it would be a $0 copay for the first 20 days, and $176 a day for days 21 through 100. Part A also offers home health care at a $0 copay, but it is very limited, and also hospice care, again with a $0 copay. Okay, so let's talk about Part A premiums. Most people with 40 quarters of Medicare covered employment do not pay for Part A when they enroll, but those who do not have 40 quarters, they would pay the following premiums. Non-working spouses can claim under the working spouse's earning record. And you can see here if you have less than 40 quarters, 30 to 39, you would pay $252 a month for Part A. All right, let's take a closer look at Part B. So Part B is your outpatient medical coverage. So Part B has an annual deductible of $198, which changes yearly. There is a standard premium of $144.60 per month for those with incomes below $87,000 as a single or $174,000 married, and this also changes yearly. You can pay your Part B premium through Social Security deduction if you're drawing your Social Security, or you can pay quarterly or authorize a monthly automatic bank withdrawal. So your Part B coverage includes, after your deductible, Part B pays 80% of the approved charges, and you, the member, would pay 20% for things like doctor's visits, outpatient therapy, durable medical equipment, emergency room visits, most outpatient services, x-rays, lab tests, blood work, etc. But there is no cap on the member's 20% responsibility. So here we have a charge example for Part B. So you go to the doctor bills $250 for a comprehensive visit. Medicare receives the bill, but they only approve $100. So assuming that your annual deductible has already been satisfied, Medicare would pay $80 or their 80%, and you, the member, would pay the other 20% left over, or in this case, $20. Now, the amount over the Medicare approved charge of $100 is written off by the provider, and this is an example of Medicare assignment. So what's not covered under Part A and Part B? Well, long-term care, routine dental care is not covered, dentures, routine vision, cosmetic surgery, acupuncture, hearing aids, and exams for fitting of hearing aids. And there is a complete list on Medicare.gov. So how do you enroll? Well, enrollment is automatic for those receiving Social Security benefits at age 65 or the Railroad Retirement Board benefits at age 65. You are mailed an initial enrollment period package 3 months before the month you turn 65 or the 25th month of your disability benefits. Other people must enroll themselves. So when enrolling is not automatic, for those that are not automatically enrolled, for example, if you're not getting Social Security or Railroad Retirement Board benefits at age 65, you can enroll through Social Security. You can actually apply 3 months before you turn 65, and you don't have to be retired. So this here is a screenshot from the Social Security website, ssa.gov. And you can see here what we have circled is Medicare enrollment. So if you have to sign yourself up, you would go here to this website, click this button, and it would bring you here to this screen. You'll have to scroll down a little bit, but you can see this button that says Apply for Medicare Only. Click that, go through the process, and it's fairly simple. It takes less than 10 minutes. Okay, so I had mentioned your initial enrollment period earlier. So this here is a chart that kind of explains that. So you can enroll 3 months before the month you turn 65. And you can see here that we have no delay and a delayed start. So if you apply 3 months before, your Medicare coverage becomes effective the first day of the month that you turn 65. However, if you wait till the month that you turn 65, your coverage then would be delayed for 2 months after that. And you can see the chart goes on here. And again, this comes from Medicare.gov. And again, this is just another chart that explains that delayed start coverage period. So if you do have a delayed coverage start, if you turn 65 in the month of June and you have to enroll yourself because you're not receiving Social Security benefits, and you enroll 1 month later, say in July, your effective date for Medicare coverage would be delayed for 2 months after July. So it would be delayed August and September, meaning that October 1st is your effective date instead of June 1st, which is the month that you turn 65. All right, let's talk about late penalties. So there is a Part B late enrollment penalty. and this penalty is for not signing up during your 7-month initial enrollment period. And this penalty is 10% more for each full 12-month period. Now, you may have this penalty for as long as you have Part B. If you sign up late for Part B during the general enrollment period, which is January 1st through March 31st, your Part B becomes effective the 1st of July after the general enrollment period ends. Now, this could be waived if you've had employer coverage through yours or your spouse's active employment. So here is a late enrollment penalty example. So Mary delayed signing up for Part B for 2 full years after she was eligible, and she did not have employer coverage. So she'll pay a 10% penalty for each full 12-month period that she delayed. The penalty is then added to the Part B monthly premium, which is currently $144.60 in 2020. So for 2020, her premium will be as follows. You can see the standard premium here. 20% of $144 equals $28.92. Added together is $173.52. But the government always rounds up to the nearest dime. So Mary's Part B monthly premium for 2020 would be $173.60. All right, let's talk about IRMA. What is IRMA? Well, IRMA stands for Income Related Monthly Adjustment Amount. And these are based upon your adjusted gross income from your federal tax return. And this is always on a 2-year rolling look-back. Now, you can appeal if you disagree or if you have a life-changing event, and we have those forms here in the office. It is the SSA 44. Now, IRMAs are paid directly to CMS, the federal agency that manages the Medicare program. You can see this is a chart here, and remember I said it was on a 2-year rolling look-back. So for 2020, they look at your adjusted gross income for 2018. And if you file an individual return and your income is less than $85,000, or if you file a joint return and it's $170,000 or less, you would pay the standard Part B premium. Now, however, if you're 1 penny above that, you would fall into the next category and you would pay $202.40 per month for your Part B. Well, Justin, what if I'm working beyond age 65? Well, let's talk about that. So Part A may negate your ability to contribute to an HSA account if you have one available to you. And this is on page 19 of the 2020 Medicare and You book. Working beyond age 65 may also affect your Part B enrollment decision. You may want to delay your enrolling in Part B if you have employer coverage, and if you or your spouse or family member, if you're disabled, is still working. And again, that's on page 19. You can always see how your insurance works with Medicare, and always be sure to contact your employer benefits administrator. So this here is actually out of the Medicare and You booklet. And you can see here that if you or your spouse or family member, if you're disabled, is still working and you have health coverage through that employer or union, contact your employer or union benefits administrator to find out how your coverage works with Medicare. And you can see here that it might be to your advantage to delay Part B enrollment. But however, coverage based upon current employment does not include things like COBRA, retiree coverage, Veterans Administration, or individual health coverage through the health insurance marketplace, like Obamacare. So if that all sounds good to you, you have a decision to make. Should you stay on your employer's plan and delay your Part B? Well, a couple things to consider. If you have younger dependents that are covered by your plan, the cost and coverage is cheaper or more comprehensive, or it could just be a personal preference. Or you could decline your employer coverage and go on Medicare. You could do the math. It may be cheaper with more coverage. And it never hurts to ask, if you go off of your employer's benefits, would the employer increase your pay? So how does your other insurance work with Medicare? We have a question coming in here real quick. It's kind of going over the presentation a little bit. I apologize for that. So Mary wants to know if she has to take employer insurance when she is eligible for Medicare at age 65. Let me go back a slide here, Mary. I'm sorry, I misplaced where I was at. I'm sorry, Mary, I will have to get back to you on that. So how does your other insurance work with Medicare? So if you have retiree insurance, insurance from your or your spouse's former employment, your Medicare would pay first, but you would need to be enrolled in Parts A and B. So if you're 65 or older and have a group health plan coverage based upon you or your spouse's current employment, and the employer has 20 or more employees, your group health plan pays first. And you can see the chart goes on there. Okay, so what about when my employer coverage ends? You may get a special enrollment period. You can sign up for Part A and or Part B without a penalty within 8 months of losing coverage based upon your or your spouse's active employment. COBRA or retiree coverage are not based upon active employment, and you may not get an SEP or special enrollment period. Now, the general enrollment period for Part B, if you're beyond your initial enrollment period and there is no special enrollment period available, this is your only option to enroll in Part B. You enroll in Part B January 1st through March 31st, and your coverage becomes effective July 1st of that year. So let's talk about Part D, prescription drug coverage. There are two ways to receive prescription drug coverage under Part D. You can join a standalone plan, which is usually a companion to Original Medicare, offered by private insurance companies, and have many options. There are actually 28 different standalone plans that are available in Kansas and Missouri. Or you can join a Medicare Advantage plan with a Part D prescription drug plan built in. This is sometimes referred to as Part C of Medicare. And there are 32 Part C plans available in Johnson County, Kansas. So what are the eligibility requirements? Well, to be eligible to join a standalone Part D plan, you must have Medicare Part A and or Part B. To be eligible to join a Medicare Advantage plan with Part D coverage, you must have Part A and Part B. You must live in the plan's service area, you cannot be in jail, and you cannot live outside the United States. You must choose a plan and enroll in a drug. You must choose a plan and enroll to get drug coverage. Plans must offer at least standard benefits, but many offer enhanced benefits. So here is the standard benefit for plan year 2020. You see at the top here, we start out with your monthly premium. This is what you would pay every month. Then we go here to the yearly deductible, which is currently $435. Then we move over here to stage 2, your copayment or coinsurance. And this is what the beneficiary pays a copayment and their plan pays its share for each covered drug until the combined amount plus the deductible reaches $4,020. Once you reach that amount, you move into stage 3, the coverage gap. So once you, the beneficiary, and the plan spend $4,020 for the covered drugs, you're now in that coverage gap. So in 2020, the beneficiary pays 25% of the plan's cost for covered brand name drugs and 25% of the plan's cost for covered generic drugs. What the beneficiary pays and 95% of the discount paid by the drug company for brand name drugs counts as your out-of-pocket spending and helps get you out of the coverage gap. Then we move over here to stage 4, catastrophic coverage. So once the beneficiary has spent a total of $6,350 out of pocket for the year, the coverage gap now ends. Now the beneficiary pays a small coinsurance amount, usually 5%, or a flat copay for brands until the end of the year. So if you're like most people, you're like, what was that? Well, I'm going to paraphrase this here. So once you pick a Part D plan, your coverage begins and you're given a hypothetical checkbook to pay for your Part D drugs for the calendar year. This checkbook has $4,020 in it, and you cannot add any money to your available balance. So the total cost of your drugs is deducted each time you fill a prescription, including the deductible, if you have one, and your copay, or a fixed amount, or coinsurance, a percentage. So for example, if your drug cost is $100 and your plan has a $0 deductible, even if your copay or coinsurance is $25, the total cost of $100 is subtracted from that balance. As long as you have an available balance, you only pay your copay or coinsurance amount when you fill your prescriptions. So again, the total available is $4,020 for the calendar year. So if we take that amount and divide that by 12, it would take an average cost of $335 to exhaust that balance by the end of the year. Should you use up your balance mid-year, then you enter the coverage gap, or the donut hole, of Medicare Part D. Now originally under Part D, you would pay 100% of your prescription cost in the coverage gap. But plans now by law must discount your cost down to a flat 25% coinsurance for both brand name and generic prescriptions. So what you pay and 95% of the discount paid by the drug company for brand name drugs counts as your out-of-pocket spending and helps get you out of the coverage gap. These amounts and the cost that you paid while you were in the initial coverage stage are used to figure out your true out-of-pocket cost, or is referred to as your TROOP. So if your true out-of-pocket costs reach a total of $6,350 during the calendar year, then you move into the catastrophic level. Then your prescription costs decrease to the greater of 5%, or $8.95 for each brand name prescription, or $3.60 for each generic prescription. Now remember, this is for the calendar year, so this starts over every January. So Part D covered drugs. Prescription brand name and generic drugs must be approved by the Food and Drug Administration. They must be used and sold in the United States. This includes drugs, biological products, and insulin, and supplies associated with the injection of insulin. Now, plans must cover a range of drugs in each category, and coverage and rules may vary by plan. So each plan may have a different list of covered drugs, and this is called a formulary. If your drug is not on the formulary, the plan does not have to pay. Formularies can change annually, And plans are required to notify members of changes by mail prior to October 1st of each year. And this is called your ANOC, your Annual Notice of Change. So what drugs are not covered under Part D? Well, drugs for anorexia, weight loss, or weight gain, erectile dysfunction drugs when used for the treatment of sexual or erectile dysfunction, drugs for cosmetic or lifestyle purposes, drugs for relief of cough or colds, prescription vitamins and mineral products, non-prescription drugs, and fertility drugs. All right, we talked about Part B late enrollment penalties. Well, guess what? There's Part D late enrollment penalties also. So if you have a late enrollment penalty for Part D, you pay a higher premium if you wait to enroll, and this is an additional 1% of the base beneficiary premium. And this is for each month you are eligible but did not enroll. Now, you would have this late enrollment penalty for as long as you have Medicare drug coverage. Now, the national base beneficiary premium is $32.74 in 2020, and this may change each year. Now, this could also be waived if you had credible drug coverage or get extra help, and we'll talk about that in a couple of slides here. So, credible drug coverage can include things like former employer or union coverage, TRICARE for our active military, Indian Health Services, Veterans Administration, or individual health insurance coverage, again like Obamacare. And let's talk about IRMA. Now again, this is based upon a 2-year rolling look back, and you can see the same thresholds apply for Part B as well. So if you file an individual tax return and your income is $85,000 or less, or if you filed a joint tax return and your income was $170,000 or less, you would just pay the standard premium. Now again, if you're 1 penny over those thresholds, you would pay your standard premium plus an additional $12.40. All right, let's talk about extra help. So what is extra help? It is a U.S. government program to help people pay for Medicare prescription drug costs. It is also sometimes called a low-income subsidy. If you have the lowest income and resources, you pay no premiums or deductible and a small or no out-of-pocket medical cost. This is Medicare combined with Medicaid. If you have slightly higher income and resources, you pay no Part B, like boy, or Part D premiums. And there is no coverage gap or late enrollment penalty if you qualify for extra help. So here we have the extra help income and resource limits. So if your income is below 150% of the federal poverty level, roughly $1,595 per month for an individual, or $2,155 per month for a married couple. Now, these are based upon family size. If your financial resources up to $14,610 for an individual, or up to $29,160 for a married couple. This includes $1,500 per person for funeral or burial expenses. It does count your savings and investments, but it does not count the home that you live in. So what is Medicaid? Well, you may qualify for free or low-cost care through Medicaid based upon income and family size. In all states, Medicaid provides health coverage for some low-income people, families and children, pregnant women, and the elderly, and people with disabilities. In some states, the program covers all low-income adults below a certain income level. So while Medicare and Medicaid sound the same, they are two distinct federal entitlement programs providing coverage to different populations. And while it is possible to qualify for Medicare and Medicaid at the same time, most people do not. All right, so let's take a look at how all these puzzle pieces fit together. So there are two ways that you can obtain your Medicare coverage. We have option 1 on the left-hand side, Original Medicare. You can enroll in Original Medicare Parts A and B, and you would pay the Part B premium. You could decide on a standalone Part D coverage, and you would pay that Part D premium, and then decide on a supplement plan to help cover Medicare's deductibles, copays, and coinsurance, and you would pay your supplement premium. So again, option 1, you have your original red, white, and blue Medicare card. You would have a card for your Part D plan, and you would have a card for your supplement plan. 3 cards, 3 premium payments. Now you can see on our dividing line there, option 2, Medicare Advantage or Part C. You enroll in Original Medicare Parts A and B, and you would still pay that Part B premium. Now, Medicare Advantage plans are offered by private insurance companies to provide coverage for Part A and Part B, and usually Part D all in one card. You would maybe pay an additional plan premium, but you would have to use networks like HMO and a PPO when accessing care, and you would pay a copayment. So we'll break it down a little bit more. Option 1, Medicare Supplements. So Medicare Supplements, their premiums typically increase with age. They are guaranteed renewable by law. So as long as you pay your premiums, you cannot be canceled or singled out for rate increases. All plans are standardized, meaning that a Plan F or a G from company X, Y, or Z will have the exact same coverage. The only difference would be the premiums. Now, Medicare Supplements do not include drug coverage, so you must enroll in a standalone Part D as a companion to your supplemental plan if you wish to have prescription coverage. Now, this here is a chart that shows the different plans, supplemental plans. And you can see here the benefits. These are what would be left over by Original Medicare. And the chart here shows what each supplement plan pays. Now, Plan F here was very popular because you can see it paid 100% of everything that Medicare left over. Currently, people that were born, or people who are eligible for Medicare as of 2020 are no longer eligible for Plan F. So the more popular plan now is Plan G, and you can see that it covers 100% of everything except for the Part B deductible, which is $198. So if you're interested in the Medicare supplement, how do you qualify? Well, you cannot be declined when you're applying within 6 months of first activating your Part B coverage of Original Medicare. You must answer health questions when applying for coverage more than 6 months after Part B goes into effect, and some exceptions may apply. Now, these carriers can use answers to those questions to either decline your coverage or increase your premiums. Now, with a Medicare supplement, there are no networks except Medicare Select policies. Medicare Supplement works with any medical provider who accepts the Medicare program in all 50 states. There is no prior authorizations required in order to receive certain Medicare medical procedures, and no referrals from a primary care doctor in order to see a specialist. Medicare Supplements will cover all or most all Medicare deductibles and coinsurance depending on the plan that is selected. Now, typically it is the largest monthly plan premium, but it is a prepaid convenience. Medicare Supplements only cover one person, so spouses must obtain their own separate policy. So we'll take a look at option 2, Medicare Advantage plan. So basics of a Medicare Advantage plan, they're a dramatically lower premium than a Medigap or a Medicare Supplement. And in most cases, Medicare Advantage plans include Part D drug coverage that is built in. Now, benefits and premiums can change every year. Medicare Advantage plans must cover all Medicare-approved services and may offer additional services not covered by Medicare, like dental and vision. There is a network for providers, either in an HMO or a PPO, and typically you pay a flat copay or coinsurance when you use the plan. So again, this is just to help understand what an HMO stands for and kind of how it works. So if you go out of network, you're not covered, so you would pay that cost. You may need a referral, and your primary doctors are limited. Again, typically the lowest copay and out-of-pocket cost, and most include Part D drug coverage built in. It is usually a smaller network of medical providers, and if you use a non-network provider, you pay 100% of the bill unless it's an emergency. HMOs have no out-of-network coverage except for in emergencies or urgent care when traveling. Now, prior authorizations may be required in order to receive certain medical procedures. HMOs can require referrals from a primary care doctor in order to see specialists, but they may offer extra benefits like dental, vision, and hearing coverage. And they usually offer gym membership at no additional cost to you. All right, so we'll look at PPO plans here. Now, PPO stands for Preferred Provider Organization. And this is usually a moderate copay and out-of-pocket cost. And again, most include Part D drug coverage built in. It is usually a broader network of medical providers. If you use an out-of-network provider, you still have coverage, but it may be at a higher cost to you. PPOs may have access to medical providers in other states or regions of the country. Prior authorizations may be required in order to receive certain medical procedures, but there's no referrals needed to see a specialist. A PPO is less restrictive than an HMO, and they may offer extra benefits like dental, vision, and hearing. And again, they usually offer gym memberships at no additional cost. And this here is just kind of a chart to compare the two. I'll give you a minute to look at that. All right, so what are the basics of a Medicare Advantage plan? Well, Medicare pays Advantage plans money every month to provide care to Advantage plan members, and these plans must follow Medicare's rules. So for billing purposes, your Advantage card is your Medicare card and is the only card that you present to the providers, but you should keep your original red, white, and blue Medicare card at home in a safe place. Now, you can change Advantage plan companies every annual enrollment period with no health questions or pre-existing conditions. How do you qualify for a Medicare Advantage plan? Well, you must live in the plan service area, and this is usually county specific. You must be enrolled in Original Medicare Parts A and B and continue to pay the Part B premium. There are no health questions, and you can only be declined if you have end-stage renal disease, which is permanent kidney failure requiring dialysis, or you are awaiting a kidney transplant. And for 2021, this section here is actually eliminated. So we've kind of gone over Medicare Supplements and Medicare Advantage plans. Which one do you choose? Well, a quick overview here. Medicare Supplements are a prepaid convenience. So you pay the monthly premium whether you receive care or not. It is typically very little or no out-of-pocket medical costs when you receive medical care. There are no doctor networks. You can use any doctor who accepts and bills Medicare across the United States. So if you had cancer and you wanted to go to Mayo Clinic, you could do that without any issues. Now, premiums may increase every year, and a Medicare supplement can only pay after Medicare approves the medical service. If Medicare denies that claim, so will your supplement. So here is a cost example. So we'll assume a monthly premium for Plan G is $125. You add your prescription drug plan premium, on average $20, could be higher, could be less. So in total, we have $145. Take that times 12 months, you would pay an annual premium of $1,740. Then you add your annual Part B deductible, $198. So then your total yearly premium plus your medical cost would equal $1,938. And your Part D drug copays are separate, but there are no benefits for dental, vision, or hearing. So now we'll talk about Medicare Advantage. This is more as a pay-as-you-go plan. So your premium is the cost of your copay when you receive care up to an annual out-of-pocket limit. Now, copays can change every calendar year, and understand and accept networks of doctors and hospitals available through your Advantage plan. Now, you may get extra benefits not found in original Medicare and a supplement, for example, routine dental, vision, hearing, and gym memberships. So this here is a cost example of a Medicare Advantage plan. Now, if you look at this, this would be an extremely bad year health-wise. So say you enroll in a Medicare Advantage plan with a $0 monthly plan premium, which includes your Part D drug coverage. Now say I send you to the doctor every month for a year, and the doctor charges a $5 copay for each visit, total of $60. You see a specialist 4 times at a cost of $50 each, $200. You go to the hospital for 3 days at $290 per day, a total of $870. 2 trips to the emergency room at $90 a pop equals $180, and 1 ride in an ambulance at $310. So if we add up all those charges there, a total yearly medical out-of-pocket cost of $1,620. Now again, your Part D copays are separate, but Medicare Advantage plan may also include dental, vision, or hearing. So let's talk about enrollment periods, because timing is everything. So let's try to understand enrollment periods of Medicare Part D and Medicare Advantage plans. So enrollment periods are the time windows in which you can make a change if you wish to. Once that time window has closed, you typically must wait 12 months to make a change to your Medicare benefits. So hello, I'm new. So if you're watching this, you're probably getting close to age 65, and you're probably getting a lot of stuff in the mail. Well, you have your initial enrollment period. So when you're new to Medicare and you enroll for the first time in Part C, which is a Medicare Advantage plan, or Part D, you can do that 3 months prior to eligibility, the month of, and 3 months after, for a total of 7 months. So once your time has run out, if you did not elect coverage, you must wait for the annual enrollment period or the special enrollment period in order to enroll. Now this here is a chart of the initial enrollment period. And you can see here, you can apply 3 months before the month you turn 65, and your coverage is effective that month that you turn 65. Now, however, if you wait until the month you turn 65, your coverage would then be delayed for 2 months after, and then it would be effective the first of the next month. All right. Well, what if I'm enrolled and I want to make a change? Well, this is called AEP, or the Annual Enrollment Period. Now, this happens October 15th through December 7th of each year. Now, during this period, one may enroll in a Part D plan or enroll in a Medicare Advantage plan, or change a Medicare Advantage plan, or disenroll altogether and return to original Medicare. Paperwork is done during this time frame with the change effective January 1st of the following year. Now, if you're happy with your current Part D or Medicare Advantage plan, it will continue into the next calendar year. You do not need to re-enroll to stay in a plan that you like. Now, once AEP closes, midnight on December 7th, you cannot make a change for your Part D or Medicare Advantage plan until the next AEP, or unless you are eligible for a special enrollment period. All right, so for my golfers out there, can I get a mulligan? Well, yes, you can, and this is called OEP, or your Open Enrollment Period. Now, this time window is January 1st through March 31st. Now, this is a switch period and is only available for people who are already enrolled in a Medicare Advantage plan. Members may change their Advantage plans, or they can disenroll altogether and go back to original Medicare and a standalone prescription drug plan. Now, however, there can be no marketing or new sales activities or events for this time window. All right, so what about a special enrollment period, or an SEP? This means something special has happened to you that allows a change for you to either add a Part D plan or a Medicare Advantage plan during the year. Now, special enrollment periods usually last for 63 days after that special event has occurred. A list of common special events here: loss of employer group coverage, loss of credible drug coverage, a permanent move of residency or a move to a different state, a Medicare Advantage trial period, if you obtain extra help. Now, there are many more special enrollment periods, but these are just a few of the common ones. All right, so now that we've gone through all of that, your heads are probably swimming. So let's look at some common scenarios to see what we've learned so far. So this here is Bob and Carol. It is March 2nd. Bob is 68 years old. He is retired, and he has had employer coverage through his wife Carol's employment since he was 65. He is enrolled in Part A, but not enrolled in Part B. And now he is losing employer coverage on March 31st due to Carol's retirement. Carol turns 65 in April and plans to enroll in Medicare. So what should Bob and Carol do to ensure there is no interruption in their coverage? Well, Bob would need to enroll in Medicare Part B, and Carol would need to enroll in Parts A and B by March 31st in order to have coverage on April 1st. Social Security office facilitates the enrollment paperwork, and Bob will be asked to have Carol's employer verify Bob's coverage in order for Bob to enroll in Part B with a special enrollment period to avoid late enrollment penalties. So once Bob and Carol have applied for Parts A and B, they can shop for a Part D drug coverage and supplemental coverage available in their area. They may also choose to evaluate Medicare Advantage with Part D drug coverage if the Medicare Advantage plans are available where they live. So here's Mary's dilemma. All right. So Mary is 74 years old, and she takes very little medicine. She takes 2 generic high blood pressure pills that she can get for less than $4 a month. And she has never enrolled in a Part D drug coverage since she thinks it's a waste of money. Well, it's now May, and she has just had a cardiac event. Her doctor is now prescribing 2 brand name medicines that cost over $400 a month for her heart condition. So what happens now? Well, unfortunately, since it's May, Mary's next chance to enroll in a Part D plan is October 15th through December 7th, that annual enrollment period we talked about earlier. And her coverage would be effective January 1st. Now, she will have to pay 100% for her medicine or see if she can get a manufacturer's assistance, which is usually based upon income. So when she enrolls in Part D, she will also be subject to a lifetime late enrollment penalty of 1% for each month that she was eligible for Part D, but she did not enroll. So again, I mentioned Mary was 74, so 9 years past 65 when she was eligible. So that's 108 months. So we take that amount and we multiply that benchmark premium, which is that $32.74, times 108%, comes out to a total of $35.36. So Mary's late enrollment penalty is $35.36 per month, but however, Medicare always rounds up to the nearest dime, so $35.40 will be added to her monthly premium of the Part D plan. So if she chooses one at the next annual enrollment period. So the end result of Mary's decision is that she cannot obtain Part D coverage until the following January. So she will most likely have to pay 100% of the cost of her medicine until January 1st. Assuming Mary does enroll in a Part D plan, she will pay the plan premium plus that late enrollment penalty of $35.40 each month for the rest of her life. Now this here is Dick, and this is one of the more common scenarios we've seen lately. And this is his early retirement offer. So Dick is 63 years old. He has worked for Acme Company for 40 years. The company then offers him an early retirement offer. The offer includes 1 month of group health insurance for each year of employment. So Acme employs several hundred people in the area. So Dick does the math, and he decides to accept this offer since he can get a job elsewhere, and he will have free company health insurance until he is almost 67. Then he figures he'll switch over to Medicare and a supplement. So Dick enrolls into Medicare Part A when he turns 65, since he does not have a premium, but he declines his Part B. He does not want to pay the Part B premium, and he's had no problem using the company group insurance. Plus, he has another 18 months before the group insurance runs out as part of that early retirement offer. So at age 65 and 6 months, Dick goes to his doctor. He presents his new Medicare card and his group insurance card to the doctor's billing office. 30 days later, he gets a bill from the doctor saying that Medicare denied his bill, and so did the group plan. He is furious and confused, and he cannot figure out why his insurance is denied. Well, here's the answer. On page 18 of the 2020 Medicare and You, it states that if you or your spouse is still working and you have health coverage through that employer or union, it might be to your advantage to delay Part B enrollment. Now again, this here is just a screenshot, and it basically covers what we've gone over. Now remember, coverage is based upon current employment, does not include COBRA, retiree coverage, VA coverage, or Obamacare, or in Dick's case, an early retirement offer. And again, if we haven't stressed this enough, if you or your spouse must actively be working in order to delay Part B enrollment while covered under that specific employer group insurance. Employers with 20 or more employees, group insurance is considered primary to Medicare. So retiree coverage, COBRA, or in this case a continuation of benefits following an early retirement offer or layoff, while many times is quite good, it is not based upon active employment and generally requires you, the member, to enroll in Medicare Part B, and it also pays secondary or after Medicare. So since Dick did not have Medicare Part B, no primary insurance exists. It is for this reason his group plan cannot pay, as there is nothing to be secondary to. By law, secondary coverage can only pay after Medicare approves a claim. And again, here is that chart. So if you have retiree insurance, insurance from your or your spouse's former employment, Medicare pays first, and you must enroll in both Parts A and B. If you're 65 or older, have group health plan coverage based upon you or your spouse's current employment, and the employer has 20 or more employees, your group plan pays first, and you can delay enrolling into Parts A and or Part B. So the answer to Dick's offer, he must now wait for the Part B general enrollment period, which again is January 1st through March 31st, to enroll. Now he will pay a late enrollment penalty of 10% added for each full year that he delayed Part B. And his Part B coverage won't start until the following July 1st. And again, you can reference that on page 18 of the 2020 Medicare and You. So since Dick's Part B coverage won't be effective until July 1st, he essentially has no coverage for outpatient services, things like doctors, emergency rooms, labs, x-rays, testings, outpatient surgeries, and the list goes on, until July 1st as well. So it's always important to talk to your benefits administrator about group or retiree coverage and how it coordinates with Medicare. All right, well, our time is almost running out, and I know you may have many more questions. Medicare is a topic we could easily devote several hours to, but our time today is limited. So I would appreciate your candid feedback on today's program. You can leave us a comment. You can tell us what you liked as well as what you didn't like. If you don't want to do that, you can also email us your feedback. And no, we won't sell your email address and we won't spam you. We hate that too, trust us. You can send us an email at info@amskc.com. And also, we would appreciate it if you click the thumbs up button on our YouTube channel if you like the class. And you may consider to subscribe to be notified of future Medicare videos. They will be shorter than this one here. So if all of this sounds good to you and you're curious as to what your next step would be, if you would like help enrolling into Medicare to make sure you avoid any of these mistakes, you can give us a call. Our phone number here is 913-214-1080. We are more than happy to help, and our services are always no charge to you. And we can compare costs and benefits for just about any Medicare Supplement plan, Part D drug plan, and Medicare Advantage plan. If you would like to stop by, we are conveniently located at 96th and Antioch. Basically, if you know where the Hy-Vee is, we are just directly behind them. All right. So if you decide to use our services, you may be wondering, how does AMS work? Well, AMS is an independent insurance agency, and we have contracts with over 40 different insurance companies. We have software programs to quote and compare them all in one easy-to-see report. We invest heavily in computer technology, and we can handle meetings and plan enrollments over the phone or using a screen sharing program, which is similar to Zoom. Now, how does AMS get paid? Justin, you'd mentioned that your services are no cost to us. Well, yes, that is correct. If you decide to use our services and enroll in a plan, AMS receives a commission from the insurance company that you choose to enroll with. Now, by federal law, Part D and Medicare Advantage plan commissions are all standardized. Medicare Supplement plans commissions vary slightly, but they're very comparable to Medicare Advantage plans. Now, our philosophy here, we model after Zig Ziglar. He had many sayings, but the one that I like the best and that we've modeled our business practice around is you will get all you want in life if you help enough other people get what they want. And that is what we're about here. All right, folks, that's all I've got. Thank you for attending.